During the later years of the Second World War, many German soldiers found themselves wounded on the battlefield and taken into American custody. They carried with them years of propaganda that shaped their expectations, and most believed that being captured by American forces meant harsh treatment or even death. The German state had repeated these ideas consistently, and many soldiers accepted them without question. Because of this, when they encountered American medics and were taken into American medical care, the experience conflicted sharply with everything they thought they knew. The interactions that followed became some of the most memorable events of their captivity, and later accounts from these prisoners described how surprised they were by the organized and neutral nature of American medical systems. When American medics reached wounded German soldiers, the prisoners were often too weak or disoriented to understand what was happening. Many expected to be ignored or mistreated. Instead, they encountered military personnel whose procedures were based on clear guidelines rather than emotion. American medics checked pulse, breathing, bleeding, and responsiveness. They applied bandages, used morphine when needed, stabilized fractures, and carried the wounded to safer locations. These medics worked under strict rules, requiring them to treat anyone who was injured, regardless of nationality. German POWs later recalled that the calm manner of the medics made an immediate impression because it contradicted the harsh image of the enemy promoted in Germany. Once German soldiers were brought into American field hospitals, they entered an environment designed to function under pressure. Many of them were surprised by the lighting, the organized layout, and the availability of medical tools. These hospitals had blood plasma units, surgical kits, disinfectants, heating equipment, and trained staff who moved through the area with efficiency. German POWs often noticed the contrast between these facilities and the conditions they had seen on their own side, especially as German supply lines deteriorated. Many German medical centers lacked basic supplies late in the war, and shortages affected nearly every aspect of treatment. The presence of advanced medical technology further surprised German POWs. They saw penicillin, sulfur drugs, clean surgical tools, X-ray equipment, and organized sterilization methods. Many German soldiers had never been exposed to antibiotics, and some believed they would have died without access to these medications. The American military's logistical strength allowed frontline medical units to maintain supply levels that Germany could no longer match. This difference in resources played a significant role in the impressions formed by German prisoners. American nurses also had a strong impact. German prisoners wrote about how unfamiliar it was to see women running medical stations, giving instructions and guiding treatment procedures. Many came from communities where women did not typically hold such positions, especially in military environments. Seeing nurses manage patient charts, organize workflows, and handle complex medical tasks exposed them to a different social structure. The nurses maintained a neutral and consistent tone, treating all patients with the same professional behavior. German POWs found this neutrality unexpected because they anticipated hostility. Surgeries performed on German POWs followed the same procedures used for American soldiers. Surgeons removed shrapnel, cleaned wounds, treated infections, stabilized broken bones, and performed amputations when necessary. German POWs later explained that the most surprising aspect was not simply the skill of the surgeons, but the amount of time and effort invested in treating enemy combatants. Many expected minimal aid or only basic treatment, not full surgical operations lasting hours. The structured nature of the care they received contradicted their earlier beliefs about American behavior. As POWs recovered, they were placed in medical wards where they received regular meals, clean uniforms, warm blankets, and daily health checks. The predictable routine created a sense of stability. Many German POWs wrote that these conditions were more stable than what they experienced in Germany during the final stages of the conflict. The availability of clean water, proper food, and hygiene products helped improve their physical and mental condition. Prisoners who suffered from untreated infections, malnutrition, or exhaustion often recovered more effectively in American custody than they had in their own units. Medical staff continued to monitor the overall health of prisoners. They tracked wound healing, infection risk, hydration, and nutrition. Some German POWs required long-term care because of injuries that had not healed properly due to battlefield conditions. American medical staff addressed these issues systematically, often revisiting old wounds or resetting improperly healed fractures. Prisoners later noted that the attention to detail shown by American staff surpassed the level of care available to many German soldiers during the late stages of the war. When POWs were transporting to the United States, many assumed the conditions would worsen during the long journey. Instead, they experienced organized boarding processes, consistent food distribution, and medical supervision during transport. These experiences reinforced their growing realization that American forces followed a structured and regulated approach to prisoner treatment. That structure continued when they arrived in the United States, where POW camps maintained medical buildings with operating rooms, recovery wards, and dedicated staff. Inside these medical facilities, German POWs received treatment for conditions that had lingered for months. Many soldiers had untreated dental issues, old wounds, or chronic infections. They were given access to dental care, vaccinations, inspections, and when necessary, additional surgeries. POWs wrote that these treatments were unexpected because they believed the enemy would not invest time in improving the long-term health of prisoners. Instead, they saw that American systems followed international guidelines and procedures. Food distribution in POW camps also followed regulations. German POWs received meals with bread, vegetables, meat, milk, and other items required by the Geneva Convention. For many prisoners, this level of nutrition exceeded what they had received as active soldiers during the final phase of the war. Consistent food improved their recovery and contributed to the stability they later described in memoirs and interviews. Work assignments were another area where medical systems played a role. Some German POWs were assigned to tasks such as kitchen work, agriculture, or maintenance. Before being assigned, they underwent medical evaluations to determine physical fitness. Prisoners who experienced pain or recurring symptoms were returned to medical care without penalty. German POWs later commented that this fairness and consistency were unexpected and contrasted with wartime propaganda. Throughout their time in captivity, German POWs observed how American medical staff interacted with them and with American soldiers. They saw that procedures were carried out uniformly and without discrimination. Nurses updated charts the same way for all patients. Doctors reviewed cases based on medical need, not nationality. Medics applied the same first aid techniques consistently. These observations helped prisoners understand that their treatment was part of a regulated system rather than an act of charity or sentiment. The neutrality of American staff continued to influence how German POWs perceived their situation. Guards assigned to medical wards performed their duties without aggression, focusing on maintaining order. Their professionalism reinforced the idea that the American military operated through discipline and procedure. Prisoners noted that guards did not interfere with medical care and did not treat wounded POWs with hostility. Over time, German POWs wrote letters home that described their experiences within the boundaries of censorship rules. Families in Germany were often surprised by these accounts, as they conflicted with the narrative promoted by the German state. As more POWs returned home after the war, their consistent testimonies helped confirm that American medical procedures had been thorough and neutral. Historians studying these accounts found a clear pattern. Medical records, camp logs, and personal diaries aligned with the statements of former POWs. American medical systems functioned with organization and professionalism, even during periods of high pressure. The experiences of German POWs were not isolated incidents, but part of a larger structure based on adherence to international rules and medical ethics. As the war ended and German prisoners were repatriated, many carried lasting impressions of their treatment. They returned home with improved health, repaired injuries, and a clear understanding of the medical structure they encountered. Their experiences shaped their long-term views of the United States. Many former POWs later wrote that the medical care they received was one of the most significant factors influencing their perception of the country. As German POWs remained in American custody, their daily lives became structured around predictable patterns that shaped their overall experience. They woke at regular hours, attended roll calls, received meals at the same times each day, and were called for medical evaluations as needed. This consistency differed greatly from the instability they had experienced during the final months of their service in Europe. Many soldiers had lived through constant relocation, supply shortages, and uncertain command structures. In American camps, the routine contributed to a sense of stability they had not felt for some time. Medical personnel continued to track the progress of recovering POWs. Some prisoners needed several follow-up examinations to ensure their wounds healed correctly. The American staff documented the condition of each patient, tracking signs of improvement or deterioration. German POWs noted that this careful record-keeping was something they had rarely witnessed in their own field units, where shortages of supplies and staff made such organization difficult. The steady attention to detail in American medical care left a lasting impression. While in recovery, POWs often remained indoors or in designated rest areas. During these periods, they had time to observe the environment around them. They noticed how medical personnel rotated through shifts, how supplies were restocked, and how sanitation procedures were performed systematically. They saw that the hospital operations did not rely on improvisation but followed planned routines. This consistency gave them further insight into the logistical capabilities of the American military. The availability of clean water for washing and drinking also stood out. Many German soldiers had spent long periods without proper sanitation. In American camps, water was distributed regularly, and washing stations were maintained with predictable schedules. Medical staff emphasized cleanliness to prevent infection and disease. German POWs described these conditions as organized and maintained with clear purpose. The constant access to hygiene products helped reduce infection rates and improved general well-being. Dental care continued to be a notable aspect of the medical services offered to POWs. Some prisoners had gone months or even years without seeing a dentist. In captivity, they received evaluations that identified decay, fractures, and infections. Treatments such as extractions, fillings, and cleanings were carried out with basic yet effective tools. POWs later acknowledged that the attention to dental health surprised them, because they did not expect the enemy to invest resources in areas not directly tied to battlefield survival. Mental health was observed in a basic but structured manner. Medical staff and chaplains monitored prisoners showing signs of severe stress or emotional conflict. German POWs later described these interactions as calm and straightforward. They were asked simple questions about sleep, appetite, and mood. While the approach lacked the depth of modern psychological care, it demonstrated that the Americans took emotional well-being into account. This was especially important for prisoners who had endured long periods of combat or had unresolved injuries. The neutral and predictable behavior of medical staff continued to shape prisoner perceptions. POWs wrote that staff members did not show anger or resentment during treatment. They performed their duties without commentary about nationality or wartime actions. This neutrality created an environment where prisoners could focus on recovery without fear of sudden hostility. Over time, many POWs became more willing to cooperate with medical instructions, understanding that the system operated without bias. Some German POWs with prior medical experience were assigned to assist in non-critical areas. They cleaned equipment, transporting supplies, organized laundry, or handled basic clerical tasks. Working alongside American staff allowed them to see the internal structure of the medical system more closely. These prisoners often provided the most detailed post-war accounts of American medical operations. They described how forms were filled out, how supplies were logged, and how staff communicated to keep the system functioning smoothly. The use of German POW labor in sanitation and maintenance tasks also served a practical purpose. Clean environments reduced infection risks, especially in recovery wards. POWs tasked with cleaning floors, laundering bedding, or maintaining latrines noticed how seriously the Americans took hygiene. These observations reinforced their sense that the medical system operated under consistent standards designed to protect all patients, including prisoners. As German POWs recovered physically, their daily responsibilities gradually expanded. Some were assigned light tasks within the medical ward, such as distributing water or helping transport equipment. Others transitioned to general camp duties. Before approval for any new assignment, medical staff examined the POW to ensure readiness. This examination was applied to all prisoners, not selectively. German soldiers later described these evaluations as fair and motivated by concern for maintaining orderly camp operations. The systematic nature of American procedures stood out more as prisoners spent longer periods in custody. Medical teams recorded patient statuses with attention to detail. They referred to written notes, charts, and official documents to determine the next steps in care. German POWs learned that decisions were made based on documented information rather than assumptions. This approach differed significantly from the improvisational methods sometimes required within the German army due to scarcity of resources. When prisoners were moved between facilities, the process was carried out with medical oversight. Those with healing wounds or specific needs were identified beforehand to ensure proper placement. Medical officers accompanied transports when necessary to maintain care standards during relocation. German POWs later wrote that this level of coordination was unexpected. They had anticipated rough handling or disregard for individual conditions, but they instead experienced structured relocation efforts. As time passed, the POWs' understanding of the American system grew more complete. They saw that the staff maintained consistent behavior regardless of external events. Even when news of battlefield developments reached the camps, the medical procedures did not change. This consistency reassured prisoners that their care would not be influenced by emotional reactions to wartime events. The stability of the system created trust, even among individuals who had entered captivity with deep fear. Food continued to be an important factor in prisoner recovery. POWs received meals at fixed times and in portions that met nutritional requirements. Many prisoners gained weight after arrival due to the reliability of the diet. Medical staff noted these improvements in their records. POWs observed that even when supplies fluctuated, the distribution process remained organized, and no prisoner group was singled out for different treatment. This fairness contributed to the overall predictability of camp life. Clothing and bedding were also monitored. Prisoners received replacements for damaged or worn items. Clean bedding was provided to reduce infection risks and maintain comfort for those recovering from injuries. These supplies were distributed according to schedules or medical recommendations. German POWs noted that these routines remained consistent throughout the year, reinforcing the sense of order within the camp. When prisoners engaged in work assignments, medical staff checked their progress periodically. If a prisoner reported pain, dizziness, or other symptoms, they were removed from the duty and returned to medical care. German POWs frequently mentioned that they were not pressured to continue working if they were unwell. This approach contrasted with some of their experiences in the German military, where soldiers often continued duties despite injuries. As the war neared its conclusion, American camps continued operating without significant disruption. Medical procedures remained the same, and supply levels stayed stable. German POWs who had experienced constant shortages in Europe noticed that the American system did not collapse under pressure. The structure held together because of efficient logistics and clear instructions, which provided insight into the overall organization of the American military. Toward the end of the war, medical evaluations became more frequent as repatriation planning began. American officers conducted assessments to ensure that POWs were healthy enough for transport back to Europe. Wounds were re-examined, infections were treated, and necessary medications were provided before departure. German POWs noted that these final examinations reflected the same consistency they had observed throughout their captivity. Upon returning home, many German POWs recounted their experiences to their families. They described the orderly nature of American medical care, the availability of supplies, the professionalism of staff, and the neutrality of treatment. These stories sometimes surprised listeners in Germany because they contradicted the negative portrayal of America that had been widely circulated during the war. Over time, as more POWs returned and told similar stories, families began accepting these accounts as accurate. Post-war interviews and memoirs from former POWs consistently mentioned the impact of their medical treatment on their perceptions. They stated that the neutrality, structure, and predictability of American medical systems made strong impressions. Many explained that they had entered captivity expecting violence and neglect, only to find a system focused on organization and procedure. These experiences stayed with them for the rest of their lives and influenced their long-term views of the United States. Historians studying the period used these prisoner accounts, along with official medical records and camp documents, to reconstruct the operation of POW medical systems. The consistency across different sources confirmed that American medical procedures were applied uniformly. The steady treatment of prisoners was not an exception, but an established policy based on international agreements and internal military regulations. For many German POWs, the medical care they received became one of the defining aspects of their captivity. It shaped their recovery, influenced their understanding of American practices, and remained a significant part of their wartime memories long after the conflict ended. As German prisoners of war continued reflecting on their experiences in American medical care, many of them realized that these experiences changed their assumptions about opposing forces. Before their capture, they were taught that enemy nations acted without rules and that surrender would lead to mistreatment. However, their daily interactions with American medical personnel demonstrated that the Americans followed systematic procedures that applied to all wounded individuals. Over time, this recognition helped shift their understanding of the broader conflict and the systems that supported each side. Some German POWs described how their perceptions changed gradually rather than suddenly. At first, they were cautious and uncertain. They expected that the treatment they received might be temporary or deceptive. As the days and weeks passed, they saw that the consistency of medical care did not change. Staff continued to check wounds, provide medication, and follow schedules with predictable accuracy. This repetition of neutral behavior made many prisoners more comfortable and reduced the fear they had carried into captivity. In many cases, German POWs who had been severely wounded arrived in poor condition. Some had severe infections, untreated fractures, or complications related to lack of medical attention. American medical staff addressed these issues steadily, prioritizing the stabilization and improvement of each patient. Prisoners noted that even those with life-threatening conditions received the same attention as less severely injured individuals. This reinforced the impression that treatment was based on need, not nationality or rank. The sense of stability also extended to the interactions between POWs and American guards. Guards operated according to set routines and communicated clearly. They enforced rules in a predictable manner without displaying emotional hostility. Many German POWs later stated that the predictable conduct of the guards helped reduce anxiety. Knowing what to expect each day made it easier for prisoners to focus on recovery rather than fear sudden changes in behavior. Communication was often limited by language barriers, but American medical staff used simple words, gestures, or interpreters when available. German POWs found that even with limited communication, the intentions of the staff were clear. They observed that instructions were given calmly, procedures were explained when possible, and guidance was delivered without aggression. This clarity helped create a functional environment for treatment and recovery. As more time passed in captivity, some German POWs began assisting American staff with general tasks in exchange for lighter duties or as part of recovery routines. These tasks included sweeping floors, organizing bedding, washing equipment, or transporting supplies. Observing the internal workings of the medical system from the inside gave them a deeper understanding of how structured and consistent it was. These prisoners later wrote that they gained respect for the efficiency of the American logistical network, which they saw operating even far from the front lines. In many American camps, medical records were maintained with precision. POWs noticed how doctors and nurses referred to charts, evaluated previous notes, and updated information regularly. This systematic recording helped ensure that each patient received the correct medication, dressing changes, or follow-up examinations. German POWs often contrasted this with their own wartime experiences, where record-keeping became difficult under conditions of rapid movement, supply shortages, and personnel losses. As POWs regained strength and transitioned to general camp life, they continued to observe the integration of medical services into the overall camp structure. Medical checks occurred at scheduled intervals, sanitation teams maintained hygiene standards, and any signs of disease were addressed promptly. German POWs often wrote that they felt physically stronger in captivity than they had felt in months. This improvement was not due to luxury, but to stability, regular meals, and consistent medical monitoring. One aspect that stood out for many POWs was how American medical personnel treated prisoners as individuals with specific needs rather than as a collective group. Even when there were many patients in a ward, each person's treatment was documented separately. German POWs later reflected that this attention to individual condition helped them feel more secure during recovery. The approach reinforced the idea that they were being treated according to medical requirements, not according to their role as enemy combatants. Rehabilitation work also played an important role in recovery. POWs who had suffered injuries that affected mobility were taught to perform gradual exercises. These activities were simple but structured. They included walking short distances, stretching, or learning to use crutches. Medical staff monitored progress without pressuring prisoners to move faster than their condition allowed. German POWs recognized that this approach prioritized long-term function over short-term outcomes. The internal order of American camp medical systems became even more apparent after the war ended. Even as global events changed rapidly, camp routines remained stable. Medical teams continued to treat wounds, distribute medication, and monitor health conditions. German POWs observed that the system did not decline or become chaotic after the fighting stopped. The continuing maintenance of procedures demonstrated that the medical approach had not depended on wartime urgency, but on established practices. As repatriation processes began, POWs underwent final medical evaluations. These evaluations documented their readiness for transport and ensured that no untreated medical issues would worsen during the journey home. Some POWs received final rounds of antibiotics, wound cleanings, or stabilizing treatments. Medical teams worked to ensure that all prisoners departed in the best possible condition. German POWs later wrote that these evaluations reflected the same careful and neutral approach they had seen throughout captivity. The transport process home followed the same structured model. POWs were assembled, registered, and given instructions. Medical personnel accompanied groups when necessary, especially those with recent surgeries or ongoing treatments. Food and water were supplied at regular intervals. German POWs noted that even in the final stages of captivity, the American system maintained the routines that had shaped the earlier months. When German POWs reached their home regions, many of them returned in better physical condition than expected. They arrived with healed wounds, improved nutrition, and stabilized health. Their families often expressed surprise at their condition, as wartime rumors and propaganda suggested harsh treatment in American hands. The stories shared by returning POWs helped counter these assumptions. As more former prisoners returned, The accounts of organized and neutral medical care became widely known in many communities. Former POWs later wrote memoirs or contributed to interviews that described their experiences in detail. Many focused on the neutrality and consistency of American medical care. They emphasized that medical staff performed their duties without discrimination and that standard procedures guided every stage of treatment. These accounts helped historians reconstruct an accurate picture of American POW medical systems. Years after the war, the experiences of German POWs continued to shape their views. Many stated that their time in American care influenced their perception of the United States. They associated the country with structured operations, reliable procedures, and consistent treatment. While their experiences did not erase the hardships of wartime, they provided a perspective that differed greatly from the messages they had received before their capture. The consistency found in American medical care also became a reference point when former POWs compared their wartime conditions to their post-war lives. They recognized that their recovery in captivity was shaped not by personal generosity, but by adherence to rules, logistical capabilities, and organizational discipline. This understanding helped them contextualize their experiences within the broader framework of wartime operations. As historians compiled these accounts, a clear picture emerged of how German POWs experienced American medical treatment. Their stories demonstrated that even during global conflict, structured medical care played a significant role in shaping perceptions and influencing long-term memories. The methodical, predictable, and neutral approach of American medical teams stood out as a defining element of their captivity. German POWs entered American custody expecting severe mistreatment based on years of propaganda. Instead, they encountered a medical system rooted in routine, procedure, and international agreements. The difference between expectation and reality was substantial. Over time, their understanding of the enemy evolved as they observed these consistent practices firsthand. For many former POWs, the memory of American medical care remained one of the most significant and lasting elements of their wartime experience.